Hi, I'm Sarah from the Microneedling Advisors team. In this tutorial, you will learn how to microneedle at home to smooth out wrinkles, plump up the skin and even out its colour. You will also see how to revise scars and stretch marks in the home setting using our professional microneedling pen, derma roller and skincare products. This treatment is easy, comfortable and safe, and it brings visible results if you do it how we show in this video. Let's dive in.
Charge your pen for 2 hours before every procedure. Your pen is fully charged when the blue light indicator is on. Take one cartridge out of its packet. It's sterile and can be used right off the bat. Install the cartridge by screwing it in clockwise. Now take the roller out of its case and rotate it slowly to check the needles. Our roller comes in a protective case, so it's nearly impossible that they will have any damaged needles, but it's still a good practice to check it before every use. After checking the needles, proceed to disinfection. For disinfection, use the pristine tablets that come free with the roller. Fill the glass halfway with water and dip a cotton pad into it. Lower your roller into the water, add a tablet, and let it soak for 10 minutes. After 10 minutes, rinse the roller with hot water and let it dry. Lastly, wipe the platform with alcohol pads and put your clean roller in it. Now, let's move on to skin preparation. Cleanse your skin from buildup and dead cells with water or a mild cleanser. Squeeze some numbing cream and apply it to your face. Please note that numbing is contraindicated in people with heart conditions. It can also cause allergies in some people, so be sure to read the instructions and patch test your cream 24 hours before use. Cover the area with a cling film and wait 20 to 25 minutes for your skin to numb. After that, remove the excess cream, clean your skin with water, and disinfect it with alcohol. Then change your gloves. Pour some HA serum into a saucer and use a clean wide brush for even application. Apply the serum to your forehead. Set the needle length to 0.5 millimeters and the speed to 3. Hold the pen perpendicular to the skin and move it in a grid-like fashion from left to right, top to bottom, and then diagonally. Move the device all the time. Don't keep it in one place for more than 2 seconds. Add more of the HA serum when it soaks in to keep the skin slippery. Your ultimate goal is an even redness, but keep in mind that redness usually appears after a minute or more. So if you've done the grid but the skin is not red, don't worry and move further. After the forehead, move on to the eye region. Shorten the needles to 0.3 millimeters as the skin here is thinner. Apply the HA serum and start. In narrow areas such as the ocular bone, you can do circles instead of the grid. Stay away from the eyeball for safety reasons. Pull the skin down from the lower eyelid to the ocular bone to make it taut and avoid approaching the eye. After finishing the eye area, set the needle length to 0.5 millimeters and continue to the lower face. Apply the HA serum and start. Treat the entire region, starting from the ears and finishing with the mouth and chin in a grid-like fashion. Make faces to stretch the skin where it's necessary. Stretching the skin is important for sufficient needle penetration. Add more HA serum when necessary to maintain the skin's slipperiness. Treat the lip line in circular motions, but avoid needling the very surface of the lips because they heal slowly, and it will be uncomfortable to eat. After finishing the face, layer some more HA to the whole area to help it heal faster and prevent dryness. After that, continue to the neck. Add some more serum into the saucer if needed. Apply the serum all over your neck and start needling. Do 27 to 30 passes in total with your derma roller. Like with a pen, we recommend doing a grid with vertical, horizontal, and diagonal passes, but if it's not convenient, you can do it in one direction as well. Don't press hard on the roller. After 30 passes, the skin should turn pink, like after a sunburn. After finishing the neck, move on to the neckline. Do not numb your skin here if you've numbed your face and neck. You should numb no more than the area of the face and neck in one go to avoid overdose. After finishing the neckline, proceed to the other areas of your body, such as arms, hands, thighs, belly, and legs, if you need to improve the appearance of your skin there too.
When microneedling the face and body, be sure to apply the HA serum during and after the treatment to speed up the healing process. And keep in mind that your goal is to get an even redness, similar to a fresh sunburn. If you see occasional droplets of blood, don't worry. Wipe them with a cotton pad and continue with your treatment. Repeat the session every 4 weeks and take the before and after pictures to see the effect clearly. Remember that it takes at least 3 consecutive sessions for your skin to visibly change and become plumper, smoother, and evenly toned. Now we will see how to deal with stretch marks. Stretch marks are more challenging than wrinkles and acne scars. That said, you can significantly reduce their visibility and even fade them out completely in the case of fresh scars. Unlike wrinkles that occur in the epidermal-dermal junction, about 0.5 millimeters in the skin, stretch marks originate in the deeper layer of the dermis, close to the subcutaneous tissue, that is about 1.5 millimeters in the skin. That's why you need to use at least 1.5 millimeters long needles to treat stretch marks effectively.
Because stretch marks require at least 1.5 millimeters deep penetration, the skin should be numbed for a comfortable procedure. Therefore, apply the numbing cream and let it sit for 30 minutes under the occlusion. After that, wipe the area with water and then alcohol pads to remove the excess cream entirely. Apply the HA serum. Install a sterile needle cartridge. Set the needle length to 1.5 millimeters and the speed to 3. Disinfect your hand, pull the skin taut, and treat the scarred area. Wipe the occasional droplets of blood and continue with the treatment. After treating the whole area, put some more HA serum on and don't wash the skin for 24 hours. Repeat the procedure after 4 weeks. After you finish your monthly microneedling session, dispose of the used needle cartridge and wipe your pen with a dry cloth. Store your device in its box in a dry and ventilated area. Disinfect your derma roller with a pristine tablet, rinse it, and let it dry. Then store it in its case in a dry and ventilated place. Repeat your procedure after 4 weeks.
Microneedling is one of the safest cosmetic procedures that brings visible results. It's much safer than lasers, chemical peels and microdermabrasion because, unlike them, it doesn't remove your epidermis entirely, but only perforates it, launching healing cascades that result in rejuvenation and collagen production with minimal injury and downtime. But like with any other cosmetic procedure, you need to do microneedling correctly. That's why we highly recommend following this tutorial and reading the tips that we published on our website about specific conditions and aftercare precautions. And of course, if you have any questions, send us an email anytime or message us on WhatsApp and we will help you out. Have a wonderful day. Goodbye.